do not attempt any of the injections that you just seen at home by yourself. This requires years of medical education, then years of actual experience injecting. Hi guys, I know you've been asking me all the time whether I do any of the procedures that I perform in this clinic myself, and the answer is a definitive yes. It's been quite a minute since I had my injections done. Reason being, I've been injecting myself for years and all of my muscles were totally numb. I had very little expression, so I allowed myself about 9 months now to go totally without any neurotoxin injections. And as you can tell right now, my muscles are fully active. They have fully recovered. And that goes back to the questions that a lot of you have. Well, what happens when you stop injecting? Well, this is exactly what happens. So nothing bad happens, because a lot of you believe that if you keep injecting Botox non-stop for years, that the muscle somehow gets totally inactivated and it never goes back to normal. So just to totally dispel this myth, you can look at me right now and you can see that I have full range of motion. It is very strong. I have all the wrinkles that you can imagine, and that is exactly what happens. If you stop using neurotoxins, your muscles will totally recover and go back to their baseline. And this is my baseline right now. And today I'm going to focus on my horizontal lines, so these lines, my frown lines, 11s, and my lateral crow's feet, okay? So that is the plan today. I may also target some of my neck muscles. As you can see, I have very strong platysmal muscles. So this is what I'm doing right now, and you can clearly see that I have these vertical neck bands. If they're not subdued over time, they become permanent turkey bands, turkey neck bands. And that is something that obviously aesthetically one would want to avoid, and that is something that I'm most likely going to do today too. Also, something important that I need to mention is that, well, what you're seeing right now is 10 months without Botox, but about 9 years of total Botox injection time. So the best way to think about it that is, if I never injected myself in the past, right now what my baseline would have been much worse. 10 years ago, I already had very severe rhytids, that's the medical term for wrinkles, and if I never touched Botox in my life, right now my whole face would be etched in very deep static wrinkles. Right now I have very faint static wrinkles, very strong dynamic wrinkles, but this is my baseline after 9 years of injecting Botox. If that was never done before, my current baseline would be much worse. I would look much older, and it would be absolutely noticeable. I used to have a very frozen look, and that is one of the reasons I stopped using it, because I wanted all of my functional dynamic expressions to be back, and now everything is back, but now it's a bit too much. So what I'm going to do today is baby Botox, but let's run through the numbers. I used to inject myself with 30 units across the forehead, 30 units between my eyebrows for the 11s, and 15 to 20 units per side for my crow's feet. For the neck bands, the amount varies. It can be anywhere from 60 to 100 units. I'm not sure how many units I will inject today in my neck bands, that depends. So with the neck bands being fully frozen, there's no functional deficit and you look totally normal, so I wouldn't worry about that at all. However, for your facial expressions on your face, so in your forehead, your frown lines, that is something that I do want to preserve, and hence I will be injecting half that amount. I will be injecting 10 to 15 units in my forehead, about 15 units in my 11s, and about a total of 20 units in my crow's feet. Alright guys, so the first step during any injection is to mark the territory to ensure that the outcomes are very symmetric. And in order to that, all the dots have to be placed with absolute precision. So that is what I'm going to do right now. I just finished all of my Botox injections. As a recap, I did my forehead, 11s, crow's feet, my masseters, and my neck, my platysma muscle. I know it sounds like a lot of injections, like a lot of units, but again, this is to reinforce the fact that there is no large number of units. If you need so many units, you just get injected and everything is fine. Any of the neurotoxin injections, they go directly into the muscle. They do not go into the bloodstream and they stay in the muscle. So you can inject, and I routinely inject into myself anywhere from 100 to 200 to 300 units because I have very strong muscles, and everything is totally fine as long as everything is properly injected. Now let's go back to the injections. As you can see, I have a little redness, which is expected. I do have a few little bumps, but because my skin is very thick, they're not super visible. And I do have a little tiny bruise right here. This is totally normal. This fades away within a few days. Nothing to worry about. So right now, post-injection, obviously there is no effect. It'll take a few days before the muscle stops moving, partially moving. Remember, I did not inject a full dose. A few days before the muscle gets inactivated. After that, my facial expressions are not going to be as strong. They're going to be softer, but they're still going to be present. I do not want to have a frozen look, that is for sure. So stay tuned, see how it all develops in the next few weeks, and I'll be back and I'll show you the final results. All right, guys, so let's go through what happened after I applied this magic wand to my face. Just a quick recap. I injected myself in my head, very strong horizontal lines, extremely strong 11s, and very strong crow's feet. However, I wanted to preserve a little of the movement, a little bit of the action. I do not like to be fully frozen, so let's see what it all ended up with, okay? So I'm now raising my eyebrows, and you can see that those deep set wrinkles, they're fully gone, but I still can maintain some sort of expression. I think I overdid it a little. It's a little bit stronger than I intended, but it's still okay. However, on my frown lines, on my 11s, that's exactly at the level where I wanted it. So they are relaxed, so they are paralyzed, but I want that little frowning action to happen and it's still going. So same applies to my crow's feet. I don't like when it's totally frozen and totally featureless. So as I'm squinting now, I still have a little action happening, but it's not a lot, okay? At my normal baseline, these are very, very strong, and they just, they just show age, and I don't like that. So essentially right now I still have enough expression, but it's not as expressive as it used to be, okay? I also injected my platysmal bands. At the baseline, they're extremely, extremely strong. They pull out of the neck, and over time, if they're left unattended, what would happen is that I would have these permanent turkey bands, okay? So to prevent that from happening, I keep injecting my neck with Botox, and essentially now as I'm trying to flex my neck, it's not as strong. There's still a little action happening, but it's much, much minimized compared to the baseline.